If you don't have 3 meals a day, if you don't have a refrigerator, if you don't have the ability to control and structure your day, if you're not safe, you can't do what's basically minimally necessary to enhance your health and well-being.
This year's summit does something different and is exciting for us in the fact that we're moving beyond just looking at housing as the only structural intervention, but really expanding our view and thinking of all the structural interventions that it takes to really help us to achieve and have better outcomes across the HIV care continuum. I come from a social work background. I'm a social work I have a social work degree, worked in the field as a social worker, policymaker, practitioner, and for me this is like, finally, we're doing something to think about the social context that people live in, and we're trying to do interventions that really help to understand and work within the context where people's lives are. I think this is important as we think about the National HIV/AIDS strategy, as we think about the HIV care continuum, as we think about an end to HIV and AIDS, that these structural interventions matter, and we want to focus on those things.
Yeah, certainly. I think it was, as we look at the research and that's currently out there, I think it's becoming increasingly clear that if we're going to actually see higher engagement in care, long-term access to care, engagement to care, but ultimately viral suppression, it's going to go beyond just the factors that we see in treatment alone. And so, we come from the standpoint from the research and everything that housing is healthcare. I think that the food and nutrition is access to care. It's transportation, it's employment. All of those become important social factors that I think represent what individuals face within a community, and I think that social context matters. And so I think that getting a better understanding that we're not going to be able to end the AIDS epidemic, we're not going to be able to end HIV without addressing the broader social context. And I think the social drivers and that focus on that is critically important.
We're really setting people up to fail when we don't ensure that people have housing and income and support, right? It's a basic recipe that all of us live by who are housed, right? All of us have, to a greater or lesser degree, those things. That enables us to do anything.
I stand in that place matters. Most people sort of think about the key factors and determinants of health, and they look at the individual. But we now know that where you live is predictably the strongest predictor of your health and well-being. In Baltimore City, there's a 20-year gap in how long you can expect to live solely based on what neighborhood you live in. It's actually a 21-year gap. The two neighborhoods are about 3.5 miles apart. 21 years based solely on where you live. So I'm glad that you guys seemingly early on got that place matters, not just the 4 walls, but also where those 4 walls are embedded in a particular context.
So when we take a look at these disparities, when we take a look at the social determinants of health, we have to realize that there are many other factors that are also associated with some of the things that we're seeing. And also when we talk about particularly domestic violence as well as stress and all these other issues, how does that relate for people who are HIV positive? If you have a stressful event, do you think that you are more or less likely to adhere to your medications? This is a question that Michael Mugavero asked in his paper that he published a couple of years ago, where he looked at the number of stressful events among individuals who are HIV positive in Birmingham, Alabama, a cohort study, to see whether or not it was associated with incomplete medication adherence. And what you could see on the left-hand side is that the greater number of stressful events that people had, they were less likely, or greater number of times that they had incomplete adherence. They also found the same thing for traumatic events. The greater number of traumatic events that you had, the more likely that you are not to adhere to your medications. So what ramifications does that have for HIV-positive women who are involved in traumatic situations such as domestic violence? And as well, what ramifications does it have for youth, particularly youth who come out and are subsequently rejected by their parents and are homeless? How does that feed into treatment and making sure that you stay in care and adhere to care for these populations?
One of the sort of challenges for HIV prevention researchers is what are the mechanisms, right? So, okay, we know these are these social drivers, and we know that we see an increased risk, but how does that happen? And so the challenge has really been on how do we understand the things that link, and this is an example where, this focus group, they're putting it all together. They talk about, well, you got no job, you're a lot of times on your hands with nothing to do but have sex and get high and liquor and watching videos, and it's sort of this notion, they have a very sort of grounded understanding of the mechanisms, and then sort of the onus now is on us to sort of test these relationships to help sort of inform policy.
We should be working on, but we're not going to change right now, the global structure of inequality and exclusion based on race, ethnicity, orientation, gender, ethnicity. But let's look at some of these intermediary determinants that serve as linkages between these broader factors and the conditions of day-to-day life that affect health. An argument that we've made, some of us for a long time, is housing is really, really unique. Housing links upstream, if you will, economic, social, cultural determinants to the more immediate physical, social environments within which we live our day-to-day lives. Housing is where our economic, social, and our personal lives come together, right? Just quoting from Healthy People 2020, our health is determined by resources and supports available in our homes, neighborhoods, and communities, right? I also want to point out the housing system. WHO, CDC talk about the health system. We've talked about that a little bit. It's not just the health system, it's crucial. Whether there is a system of preventative resources and health care if persons are ill, sick, or injured, but there's also the housing system. There's also the social welfare system. There's also the criminal justice system. And there are other systems as well too, meaning by that, the groups, the organizations, the processes, the formal and informal rules and regulations that themselves can help us put us in the place that we have increased exposures to negative risks for poor health outcomes, or mitigate or moderate exposures and consequences.
When people are negatively impacted by social determinants, they're not just impacted by one. And various social determinants can inform each other. While getting somebody access to stable housing is very important, if we haven't addressed the nutrition need, then we might have failed. Somebody who has a long history of incarceration or a history of trauma is going to potentially react differently to having their own space than somebody who hasn't had that history. So all of these interventions that address the social determinants are important, but to achieve maximum efficacy, they have to work together.
I think some of the important social drivers, one of which is clearly unstable housing and homelessness in the United States, especially as related to HIV. And I think one issue is making sure that we have good estimates of the size of that unmet need. How many persons are still homeless or unstably housed? What's the best array of services to offer? And what does that cost per person? And how do we marshal the resources to do that? I've been a bit worried that the housing opportunities for people with AIDS has been relatively flat funded for several years. And if we want to achieve more and more aggressive goals in the updated national AIDS strategy, which is a great thing, I think we should have more aggressive goals, we've got to make sure we have the resources available to do that as well.